my name's Sonia Hosner, and my project is on whether or not placebo arms are beneficial when you conduct a clinical trial. In this presentation, I will provide you with some background information, my method, my results and analysis, and then a conclusion, and lastly, my references. So for some background information, what really is a placebo? So a placebo is sometimes called a sugar pill because it's a pill that doesn't contain any medicine, and it's given to patients by like doctors or clinicians so they can see if there's a drug effect and if their drug is actually working or not. So it's anything that seems to be like a real medical treatment, but it isn't, and it's like a lookalike. So the placebo effect is it's an effect where like clinicians or patients think that the patient has like actually taken a drug and they've actually taken the placebo and then they're convincing themselves that they're doing better and that they've received the drug. So for my procedure, I used two databases, which are PubMed.gov and clinicaltrials.gov. And my plan was to investigate 5 multi-arm clinical trials, so that included a placebo arm. And then I analyzed the results and I compared the active data to the placebo data so I could see how much the drug was working. I also located and examined each placebo effect. And then lastly, I constructed tables and graphs to visually represent what was happening. So for my results for my first trial, so I chose a study which was where they added statins to ACE inhibitors so they can measure their endothelial function and their blood pressure. So in the trial, they were adding the statins, which is it's a drug that's already known to lower cholesterol, to the ACE inhibitors, which are known to lower blood pressure, to see if it's an added benefit. And as a result, there is a placebo effect because after 0 minutes, the placebo group improved around 8% more than the control group did. And since both the placebo group and the control group aren't receiving an active drug, they should have improved the same amount. So what's happening here is that the placebo group is convincing themselves that they're receiving the active drug and they're telling themselves that they're doing better. So their endothelial function is improving. And you can also conclude from this data that statins are an added benefit to the ACE inhibitors. And you can see this when the statin patients improve after both 1 and 5 minutes, and the placebo and the control group patients don't. Actually, the placebo patients don't, sorry. The control group patients still improve by a little, but not as significant as the statin patients. So for my second study, I chose a study where they are examining postural tachycardia syndrome, and they're finding if there's a placebo effect. So as like an abstract of this study, they measure the heart rate in patients with postural tachycardia syndrome. So it's a syndrome in which the patient's heart rate increases excessively when they stand up. So they measured their heart rate when they were sitting and then every hour after they've stood up. Approximately half of these patients are on a placebo pill and the other half aren't on a drug. So there's no active drug in this study. It's just placebo and no drug, like the control group. So the placebo effect is you can only examine it when they are sitting because once they stand up, their disease becomes the controlling factor for this and it has dominance over them. So they can't control their blood pressure anymore because their disease is taking over. So an example of like, well, when you look at the seated patients, you can tell that they have the placebo seated patients have a lot lower blood pressure than the no drug patients when they're seated. And this is like an opposite of white coat hypertension. So that's when like a patient's blood pressure increases in front of a doctor. And instead here, um, these patients are actually have a lower blood pressure because they think that they might be on a drug that is helping lower their blood pressure when really they're on a sugar pill. And the placebo and control group have different results in this study when they're seated, and that's what is the placebo effect. So they should have the same results because neither of them are receiving a drug, and instead the placebo patients have different results. Yeah. So for my third study, I chose um, a study that was examining whether coenzyme Q10 would decrease statin-related muscle pain or not. So the abstract of the study was to recruit 50 patients with statin-related muscle pain and then have both of them fill out a BPI questionnaire, so a brief pain inventory questionnaire, and then they would also receive blood testing before and after the trial. So this data will then be used to determine if coenzyme Q10 is a treatment for statin-related muscle pain. So here, day 0, we used day 0 as a control group because they didn't provide us with a control group. And before they started, it's actually would be the same. So you can see that the improvement of the placebo patients. So they're measuring on a pain severity score, and you can tell that the placebo patients had lower pain after the 30 days. So this yellow area right here is actually the placebo effect because the blue and the green should be the same result since they're on a placebo pill. Another thing you can conclude from this is that coenzyme Q10 is in fact a treatment for statin-related muscle pain because the yellow difference for the Q10 is significantly larger than the yellow difference from the placebo. So it has worked in more patients and is proven to be a treatment. For my fourth study, I chose to see if blueberries improved endothelial function in metabolic patients, so patients who are at like high risk for like strokes and heart attacks. So the abstract of this was to conduct a clinical trial in which 23 of the patients would receive a blueberry smoothie and the rest would receive a placebo smoothie. And this is twice a week over 6 weeks. So every 24 hours, the patient would get their endothelial function assessed, both before and after, and then all of this data would be used to determine if blueberries are an added benefit and are beneficial to metabolic patients. So one thing you can see in this data is that they do in fact improve endothelial function, and you can see this when the um, the improvement rates of the blueberry patients are 65% larger than the improvement rates of the placebo patients. And the placebo effect in this study is in the specific patients. You can see it in the lower figure on the right. So all of these couple patients here that think they have improved on the placebo, and which they can't because the placebo wouldn't provide them with anything that would help their endothelial function. So another thing you can see would be a possible nocebo effect. So a nocebo effect is when the patients actually have a negative mindset and that they think like, so it would occur in active patients who think that they are on a placebo pill because they don't know that they're on the active. So they might think that they're not doing as well because they are on a placebo. So it's the opposite of a placebo effect. And we can't confirm this, but it could definitely be a possibility here. And you could see in these couple patients on the bottom part of the figure on the left. And the last thing is that you can't actually calculate the placebo effect percent here because there's no control group and we don't know, although we can see the placebo effect in the individual patients, we can't actually calculate the percent of the overall ones. So for my fifth study, I chose its characterization of placebo responses in stable asthma. So here they gathered patients and they broke them up into 4 groups. So the albuterol, which is the inhaler, the active one, and then it's also the placebo inhaler, placebo acupuncture, and the control group. So then they performed spirometry, which at each of the 12 visits, which is a test of lung function. And so in this study, there is 2 placebo groups. There's the inhaler and the acupuncture. And you can see that in both placebo groups and the control group, there was very similar objective measures, meaning that they actually had really similar results. But the placebo effect comes in when their subjective measures are much larger in the placebo groups than in the control group. So they should have the same results because the control group um, is also not receiving a treatment. Well, yeah, and it's not an active treatment. So they know that they shouldn't improve because they're not receiving anything while the placebo patients aren't really sure if they're receiving something or not. So that's where the placebo effect comes into play. In conclusion, um, so the importance of the study would be that the placebo effect does exist, and if you include a placebo arm in a clinical trial, it makes your results more reliable and eliminates the bias. So, some future steps in this experiment would be to um, perform this experiment again, but to add more studies so that the results would be more detailed and accurate. And lastly, I have my references, which I use throughout the presentation. Okay, thank you. Have a nice day.